According to a 2014 National Non-Communicable Diseases Risk Factors Survey, Botswana has 29.3% prevalence of hypertension among adults aged 15 to 69 years. While a big concern currently may be whether or not healthcare services are responding effectively to this huge burden, how much of it is attributed to the general public's lifestyle choices?
Ke na le 25 years. Hampieno ana ke bua ke na le 65 years. O ka bona re ke godile ka yona. Ke re nna ke le mogile go bolwetse ya high blood pressure. Buirwa ke gore o na le sengwe se se go khopisitseng. Se nna mahatheng a gago. O sa sentse ko nte. O ba mo pilung.
Once again, we visited our resident doctor to expand more on.
Okay, thank you. So traditionally, hypertension is classified into two, right? We have primary or essential hypertension, and then we have secondary hypertension. Primary hypertension is in the majority of the patients, and about 90 to 95% of the patients. And we deem it as primary or essential because there is no identifiable cause of the hypertension. The other 5 to 10% have what we call secondary hypertension, meaning one can identify a cause of the hypertension. Often secondary hypertension is diagnosed in younger patients. Often it can also be diagnosed in patients who have very difficult to control hypertension. In terms of adjustments, often patients have to make many adjustments. The first thing, obviously, is accepting the diagnosis, which is often a huge challenge, both for the patients and both for their caregivers. They then have to adjust their lifestyle, and that's also a big thing because they have to adjust the way they eat, which is an important component in terms of managing the condition. And when I say in terms of how they eat, it involves what they eat, how they eat, how often they eat, and most people struggle with that. The second thing becomes having to take medication every day. Like most people cannot accept that it's a chronic condition that needs lifelong therapy. So that's also a big adjustment. In urban areas, traditional food, to call it, are actually becoming a delicacy. We know now it's common for people to have traditional foods as part of their lunch, but it's not like their staple food, if I may put it that way. Like often bohobela balerotse, koko ya Botswana type of thing are sold as delicacies, right? So it's not the bulk of their diet. Whereas in non-urban areas, for example, then they use traditional foods as the majority of their diet.
Ke ne ke thusiwa ke gore ko dingakeng tsa rona tse sekgowa ba re thusa gore re monitor bolwetse jo jang kana re ithokomele jang mo bolwetseng jo. Sa ntlha ba re ruta gore re je sentle, re je dijo tsa rona tsa Setswana, re simolola re rute batho ka yone bolwetse jo gore bo tseno le ke bana jaanong re ba rute le gona go ja gore ba ithokomele mo gona go ja ke gone mo go tisang one malwetse.
Hypertension is definitely a concern for most, if not all of us. But it is reaffirming and assuring to know there are people living and coping with it just fine. Knowing the various simple adjustments we can make to manage our blood pressure is very important to help minimize risk of finding ourselves at high risk individually and collectively outside of medical interventions. That puts a lot of power on our lives back in our hands.